Good afternoon, everyone. My name is Paola Filaneto, and I am the chapter president for UMass Informs, and I will be your host today. It is a great pleasure, especially for me, as I share presently the advisor that the UMass Amherst student chapter of Informs and its faculty advisor, Professor Naguni, received today Dr. Destenie Nock. So Dr. Nock is a leader in energy justice and sustainable energy transition trade-off analysis. She is an assistant professor at Carnegie Mellon University in civil and environmental engineering and in engineering and public policy. In her role as an assistant professor, she creates optimization and decision analysis tools which evaluate the sustainability, equity, and reliability of electricity and transportation systems in the US and sub-Saharan Africa. Dr. Nock has a PhD in industrial engineering and operations research from our very own University of Massachusetts, Amherst. And here she was an NSF Graduate Research Fellow and an Offshore Wind Energy IGERT Fellow. She also earned a Master's in Leadership for Sustainable Development at Queen's University at Belfast, and 2 bachelor degrees in electrical engineering and applied math at North Carolina A&T State University. She's creator of the Black Electricity blog, where she posts articles about graduate and undergraduate advice. And I have checked a couple of them myself. I suggest these too. And she also talks about research updates and energy and sustainability. So thank you very much, Dr. Nock, for taking our invitation and for sharing here your knowledge with us. Feel free to start your presentation after. I don't know if Dr. Naguni wanna make some remarks.
Yeah, I'd like to welcome everyone, and it's such an honor to have one of our distinguished alums speaking today. She was a fantastic member of our UMass Amherst Informed Student Chapter and the best moderator you can imagine when it came to our STEM Slam, which was so much fun. So this is extra special. Thank you, Dr. Nock.
Awesome, and thank you for having me. So today, what I'm going to discuss is some of the research that we've been doing surrounding the COVID-19 pandemic, which I'm sure many of you are familiar with, and the transportation implications that we are seeing come about from differences in the way that people are using public transit, in addition to the way that people are actually sourcing some of their groceries and food. So COVID-19 has changed the perceived risk of going to the grocery store, and this can be related to 2 different things. So the first is actually the risk of catching COVID on the bus system, which could lead people to avoid public transportation. And then there's also the perceived risk of actually shopping in the grocery stores, because that is one place where a lot of people were interacting. And so then that could lead customers to have their groceries delivered and make higher levels of use of these grocery delivery services. Now, autonomous vehicles are one potential emerging technology that can help reduce this risk, which leads us to 2 research questions. First is, how much can autonomous vehicles reduce the risk of catching COVID on public transportation if this was used as a supplemental technology to help people move to and from different locations? And the second is, how does grocery delivery impact the overall transportation system as a whole? So first, we're going to discuss our analysis of the public transit system and the method that we have used to identify different trade-offs between risk reduction on the public buses, as well as the costs involved with altering the public transportation system to include some of these more emerging technologies. So as I mentioned before, COVID-19 has affected the perceived safety of public transit services, and this really has highlighted the public health issues and inequities that we were seeing on public buses. Public transit does have an obligation to meet the transit needs of its commuters while also keeping them safe. And so there was a really big concern about essential workers, particularly because there are transit-dependent populations who don't have cars, right? Just people with disabilities are often ones on the bus, as well as low-income commuters. So the first research question that we posed is, what is the actual COVID risk of crowding on the bus? And so one of the reasons that we're looking at this is because here in Allegheny County, where Carnegie Mellon is located, our bus service is called the Port Authority, and they actually instituted limitations on the bus. So certain buses could only have 10 people, where the actual capacity may have been 60. But there was evidence that bus drivers were not adhering to these limitations. So that is a risk of crowding. And then the second research question is, what policy alternatives could help alleviate the crowding and reduce this risk? Our approach involved first assessing the bus demand during COVID. Then we modeled 4 different policy alternatives, which I will discuss in future slides. We used a Monte Carlo simulation to model COVID risk, and this is also tied with an epidemiological model. And then we evaluated the social and operational costs of each of our different alternatives. This graph is giving you a sense of how bus ridership changed during the COVID pandemic. So on the x-axis, we have the different dates, and this is all different months of the year, and this is all for 2020. On the y-axis, we have the total bus passengers, and the red line represents the weekday passengers, the middle line represents Saturday passengers, and the dotted line at the bottom represents the Sunday passengers. And so right here, towards the end of March, we see a huge decrease, 80% drop in ridership from January to April. And that is a direct effect of the COVID pandemic and the city instituting their stay-at-home orders as well as their school closure orders. So we do see that there is a huge shift just in people avoiding the bus. One, because they don't need to travel, but there is still some retention of ridership, particularly during the weekday, which are where our essential worker population would fall. In addition to the total ridership shifting, we also see that the peak hours have shifted. So again, on the x-axis, we have the different hours of the day. On the y-axis, we have the number of passengers, and the blue dotted line represents January to February of 2020, and the red line represents April to May of 2020. And we see that, before the pandemic started, we had 2 traditional peaks in the morning and in the afternoon when people were going to and coming home from work for the typical 9 to 5ers. But during the pandemic, so the red line now, we see a peak kind of starting in the morning again, but it stays pretty consistent until we get to the afternoon peak and it tapers off. So a lot of our essential workers are not necessarily following the specific 9 to 5, and this is because we're seeing hospital workers in these time periods coming to and from work, as well as grocery store workers. So again, attempts to reduce risk on the bus. So first, physical barriers like mask requirements are of course very popular and one of the main strategies, as well as capacity limits on the bus to promote physical distancing. And so when we are thinking about the challenges with this, both have challenges with actually instituting and requiring people to adhere to these mitigation measures. But this capacity limits to promote social distancing has another challenge, which is unmet demand of the public bus system. And unmet demand can happen in one of 2 ways. This could be first, passengers just getting passed by from the bus driver, which we know that with bus drivers, they know their passengers very well, especially the ones that are very consistent riders. And so they may have what they feel is a moral obligation not to let people who they know are going to miss work get passed by on the bus. So then this could lead to overcapacity or crowding, where overcapacity is defined as the peak load subtracted from the mandated capacity And this leads to extra crowding, which then raises everyone on the bus's risk of catching COVID. Here is a table of our unmet demand that we calculated for April to September of 2020. And when we are looking at the actual, so first we have the months, we have the actual overcapacity ridership and just total numbers. We have the total amount of ridership, and then we have the percent of riders that were actually overcapacity during that period. And so we see that in general, it's pretty low. We have 4.3% on average of total percentage of rider overcapacity. So this, when you see these numbers at first, you're like, oh, well, that might be low, but given that the ridership has remained low, Allegheny County wanted to investigate some additional policy alternatives for reducing this overcapacity and reducing the perceived risk. So for our policy alternatives, we, one, have the business as usual case, which is just to allow overcrowding. Then policy 2 would involve dispatching additional buses to take in those overcapacity riders, which are the pink stick figures. Policy alternative 3 could involve dispatching autonomous vehicles, and that would be 1 per overcapacity passenger. And then 4 would just be to dispatch longer buses, because the capacity limits on the buses were as a function of square footage of the bus. So then with longer buses, you could actually take in more riders. So when we were building out this model, here are some of our key assumptions. First, that we are assuming that all passengers are wearing a cloth mask, and that cloth masks are 35% efficient. And we assume that 90% of the passengers are sitting quietly, while 10% of the passengers are sitting and speaking. And the percent of the contagious passengers on the bus is representative of the percent sick in Allegheny County on a given day. And that we assume then that contagious people are contagious for about 20 days total. So for the percentage of sick residents, or row D, that's equal to the total new cases in the past 20 days divided by the total county population. And when we are looking at modeling the sick passengers on the bus, this is going to be a function of the people on the bus, the percent of people who are actually sick, and the number of sick passengers. And this is the epidemiological type-based model that we are using in our analysis. And to capture the total level of risk, we use a Monte Carlo simulation. So some of the inputs that we vary are the sick passengers per trip, the number of infected people per trip, and the autonomous vehicle commute distance. We run 1,000 simulations, which includes 76,000 trips per run and 4 policy alternatives per trip. And then for our sensitivity analysis, we rerun 11 different scenarios where we look at upper and lower bound of autonomous vehicle costs, as well as the different levels of COVID cases, bus demand, social cost of carbon, and also the value of a statistical life. So now the moment you've all been waiting for, our outputs, right? So for here, this is a histogram showing the infections that we estimate would happen on the public bus system when allowing crowding. And on the x-axis, we have the number of infections, and on the y-axis, we have our simulation. So from April to September of 2020, we estimate that there were 250 or over 250,000 total overcapacity riders. And on average, we see about 121 infections occur or estimated to occur in our simulations on the buses. When dispatching autonomous vehicles, on the other hand, we find that between April to September, we would decrease these infections to 71 total, which is a 41% reduction by dispatching autonomous vehicles, which in this case, Port Authority, I should mention that Port Authority does not currently have any autonomous vehicles in their in their fleet, but this could also occur through a partnership such as Uber and Lyft is another policy option that was mentioned with the Port Authority. So looking at our 4 different policies, we have the number of infections with allowing crowding is the green, the number of infections with extra buses is the blue, number of infections with autonomous vehicles is the gold, and then number of infections with longer buses is the brown. And the percentages here are the percent of estimations that are over 100 infections occurring on the buses between April to September of 2020. So we see that the lowest amount of infections that we estimate would occur with over on the buses would be from autonomous vehicles, followed by longer buses and extra buses. And then of course, the base case of just allowing crowding is the worst. So all of these policy alternatives represent a significant improvement in the risk reduction on the public buses. And now the big question is how might the different costs of implementing these different policy alternatives actually go? And then we also need to investigate what context this includes. So here we're just kind of giving you the context of the overcapacity cases. So our overcapacity trips, we saw that was about 52%, or 238 cases actually we've seen infections occur there. Then for all bus trips, we see about, assuming 451 cases, or 4% of all trips would then lead to potential COVID spread. And then this is actually a small portion of the total amount of cases in Allegheny County, which were about 10,000 during the April to September timeframe. Now, we also want to acknowledge that in spring 2020, it was a very low amount of COVID cases just in Allegheny County as a whole. So when we normalize these to winter levels, we do see an increase in the number of case estimates that are just occurring from actually riding the bus. And so in the winter, we saw about 52,000 cases in Allegheny County. From all bus trips, we find that still about 4% would come onto all buses, which is about 2,100 cases. And then from those overcapacity trips, we see that that's 38% of just the bus ridership, and that's about 800 cases. And so one thing I do want to make sure I emphasize is that this is just our estimate for people who are actually riding the bus. It does not account for people who contract COVID once they get to their destination from actually being at that destination. So here I am showing the cost breakdown of different policies, of the different policy alternatives, which are on the x-axis, where we have allowing crowding, extra buses, AV dispatch, and longer buses. The blue, and the cost in millions is on the y-axis. The blue represents operational costs. The orange represents the cost of COVID-related deaths. The yellow is the estimated congestion and pollution costs, and the green is the social cost of carbon. So one thing that we see here is that in general, the allowing crowding and extra buses are the two highest costs for the Allegheny County and as a whole. And the AVs and longer buses actually have similar overall costs and infections. Now, I will throw in here that the cost of COVID-related deaths does depend significantly on the value of a statistical life that we use. And then also that dispatching extra buses did have a significant infection reduction, but it also has the highest operational costs because this would involve the actual bus authority of Allegheny County to actually buy more buses in their fleet, where they actually had longer buses currently in their fleet that they were not using during the COVID time period. So that's one reason why we see a large difference in the operational costs between extra buses and longer buses. Okay. Then we also asked ourselves, well, how does this crowding affect, how does this crowding differ between different minority groups, as well as, and what might be the equity implication of this? So here you're seeing a heat map where the lighter the color, the less minorities there, and the darker the purple, the higher percentage of minorities there. The different dots represent the mean load in that area, so the mean bus load. And the white dots represent a very low bus capacity, and the dark red dots represent a very high capacity. And then we've summarized those numbers here in this table next to it. So when we look at the low percent minority areas, we see that there is a very low average passenger count. The average passenger count is like less than 1. But then when we move to the highest bracket of minority areas, so when the percent minority is over 41.7%, we see that the average passenger count is about 6. And this does show that there is a higher level of crowding in minority areas throughout Allegheny County. And we also saw something similar in the low income areas. So one suggestion that this, or one implication that this can have for the Port Authority, is to think about reducing crowding and congestion at some of the tails of their bus system when they are seeing more minorities and lower income residents using the buses, especially since those are essential riders during the COVID pandemic. Here is a graph of the trade-offs between costs and infections as demand increases. So one question that the Port Authority had is, how is this analysis going to change if demand for bus usage returns to pre-pandemic levels? So on the x-axis, we have the number of infections, and on the y-axis, we have the cost in millions. And the gray line represents autonomous vehicles. The red or orange dotted line here represents longer buses. The blue dotted line represents allowing crowding. And then the yellow dotted line represents extra buses. So we see that for allowing crowding, which was the base case, that has the longest or highest potential impact in both the cost and the infections, and that has to do with the value of a statistical life here as well. And then the most robust one against demand is autonomous vehicles, which again could be a partnership with Uber and Lyft type of ride-sharing platforms. And then the other one, let's say, you know, they were not wanting to partner with Uber and Lyft, extra buses would be a viable option. But when cost becomes a concern, then they probably will shift to dispatching the longer buses currently within their fleet. So some limitations. One of the key model limitations here is that unmet demand is not measured directly. There is not currently a data collection on who wishes to ride the bus but then chooses not to due to, you know, lack of service or missing it, for example. And we do not consider the policy alternative where the transit agency just accepts unmet demand as an option. In our simulation, they either allowed crowding or they dispatched a policy alternative to absorb that unmet demand. And so we did not assume the pass-by alternative. Some policy limitations of actually implementing this work include that bus unions in Allegheny County, which would make autonomous vehicle agreements difficult to procure. And then autonomous vehicles in general do face high levels of policy regulation prior to commercial adoption. So some conclusions. Here in this analysis, we saw that overcapacity trips were about 12% of the ridership, but accounted for 52% of the infections on the bus. This is something for Port Authority to consider as they are moving forward with COVID mitigation policies. And we found that within our modeling framework, about 4% of all Allegheny spring 2020 COVID cases were estimated to be transmitted on the bus. Our policy recommendations are that dispatching autonomous vehicles or longer buses would be the most cost-effective policy alternative. And as COVID rates increase or the bus demand increases, the autonomous vehicles do become a better option. So I want to just bridge slightly into autonomous grocery delivery, which builds on this thought about how autonomous vehicles may impact the way that we are operating in our cities. And I should have said that my first PhD student, Lily, led the last analysis, and now my other PhD student, Mateo, has been leading this analysis. So grocery delivery could have lasting impacts on grocery sourcing behavior. And how it relates to COVID spread is that, reducing the amount of people actually taking the bus, reducing the amount of people in the grocery stores by having groceries delivered, just promotes one more alternative for social distancing, as well as promoting people to stay at home and isolate more efficiently. And so we're seeing services like Instacart, as well as Amazon and Whole Foods delivering more food to people's homes. And then there are already autonomous food and grocery delivery pods that have started to be in testing. So for our research methods, we have been creating a simulation model that looks at the ways that people may change their behavior. So here a TAZ represents a traffic analysis zone. And this is our original tour or series of trips where somebody would start at their home, they would go to a grocery store, go somewhere else, maybe to work or shopping, they'd go somewhere else and they would come back home. But then with the grocery delivery, now we're seeing modifications where you would go from home, you would skip the grocery store and go to, maybe you're shopping, you're going to go somewhere else, then you're going to go back home. And then now the grocery store is going to have to make a delivery to your home, and then they will come back to the grocery store. So this is going to have, or could have, a large impact on the amount of vehicle miles traveled that just overall cars are making throughout the city. So here we are showing you the batch size on the x-axis and the variation in vehicle miles traveled on the y-axis, where batch size represents how many groceries are getting delivered at the same time by one vehicle. So when we see that the worst case, and this is assuming that 40% market penetration, where 40% of the residents within the city are actually getting their groceries delivered. So here we see that we actually have a very strong increasing benefits where the vehicle miles traveled are decreasing as we increase the batch size. And that represents lower just total vehicle miles traveled, as well as it will lead to impacts on the emissions reductions within the city. We do find that the worst case scenario is when the market penetration is 100% and the batch size is only 1, I should say. And because that then leads to an actual increase of emissions. So this is some ongoing work, and we are refining our Monte Carlo analysis to try to understand how different batch sizes will impact overall congestion and vehicle miles traveled within the city. And then we also are going to tie this to understand the congestion implications. So here we are implementing the changing travel patterns into a travel simulation software called VISM, which is a static traffic assignment model. And the map of Seattle, which is our case study, is on the right side, where the green represents complete free flow of traffic, which is no congestion. The yellow represents mild congestion, and the red and dark red represent very severe or moderate congestion. So here we implemented our base case into the Seattle VISM software framework, and we have the dots representing the different grocery stores throughout the city of Seattle, and the red and yellow are representing the places where we are seeing a lot of concern of congestion within the Seattle area. And when we include grocery delivery, where the scenario is 100% penetration in a batch of 1, we start to see more congestion around these supermarket areas, and that I've conveniently circled for you in case you're wondering where they were. And that has concerns for the city of Seattle because congestion does increase the emissions within the city, as well as overall just negative sentiments. So next steps for this analysis include refining the congestion analysis and expanding to the entire Seattle metropolitan area and including multiple scenarios for delivery patterns. We want to integrate autonomous vehicles into this analysis as well to understand how different types of vehicles may impact the overall emissions. So for some overall conclusions, autonomous vehicles are an emerging technology that can alleviate crowding on public transit and help with grocery delivery. Grocery delivery may lead to more congestion once we reach high levels of penetration if delivery is more used as a complement as opposed to a supplement. I would like to acknowledge my research team, which are my PhD students, Lily Hainig and Carlos Mateo Samudio Lezcano, and the co-advisors who have helped me work with these students, Corey Arper, Greg Lowy, and Jeremy Mahalik. And of course, our funding supported by Mobility 21, Traffic 21, and our Atlas Moonshot in the College of Engineering at CMU. So thank you very much for having me.
Thank you.
Thank you. I would like to open for questions. If anybody has a question, they can move on. I see a hand from Professor Nardini, so please.
I have a couple of questions. Thank you for mentioning Seattle. My daughter is now teaching in Tacoma. I was in Seattle in August and the congestion was absolutely horrible. So I was wondering what algorithm for traffic assignment, I don't know whether you know, that the VSIM package has implemented. Do you know?
I am not sure. I know that for us, what we do is we take the origin destination pairs of the matrix for the entire city using the different traffic analysis zones or TAZs. And so we would actually have those for the entire city and for people to represent people moving back and forth. And that is what we integrate into the VISM model.
Okay, if you find out what the algorithm is, I'd be really interested if it's Frank Wolf or DeFermo Sparrow, which one? Because there are issues with accuracy too. Some are more accurate than others.
Okay.
We have a hand from Jahina. I'm sorry if I said your name wrong, darling. Please go on.
That's okay. It's Jahina. I find post-COVID transportation to be very fascinating. So this is less of a question, more of a comment. I'm from Springfield, which is like really big on public transportation. Like we have a major bus station, train station, everything. And one of the things that they did in order to reduce the number of people who had to rely on public transportation was they pretty much made it easier to get a driver's license. And so usually you have to bring your own car to test, but they bought cars so that people could just use theirs. And they made it so you can reserve an appointment and fill out all your paperwork online before you get there. So it reduced basically the hassle associated with it. So I definitely think this is interesting.
Yeah, and just to like add to that, one of the things that we've been seeing now is that while the bus authority in Pittsburgh had assumed that the ridership would return once things open back up, it just hasn't. And maybe a part of that is more people getting driver's licenses, as you mentioned. But the other challenge that they're seeing is more remote work policies being instituted. So before the COVID pandemic, a lot of people just couldn't work remote. But now you're seeing a lot more flexible schedules, as well as the schools kind of shifting now to like online as well. So a lot of this peak ridership often came from students who would go to campus and then just stay there and then go back home when their classes were over. So I think that there are a lot of structural changes that definitely needs to be integrated into analysis as well, because the ridership just hasn't returned as they expected it to.
Baker, please.
Hi, so thank you. This is all very cool and interesting. All kinds of different modeling applied to different questions, which is fun. So my question that I was really interested in trying to understand why the autonomous vehicles are so cost effective. Because it seems like if you take it to its logical extreme, it doesn't make sense, right? I mean, we don't want to send a bunch of autonomous vehicles out to pick up everyone. So it must have something to do with the distribution of passengers, and that there's a small number of extra passengers or something. And then a related question, if I can go on, is did you model, when you showed the different concentration, did you actually account for that? Because what I'm wondering is, would you want long buses in certain areas where there's dense ridership and autonomous vehicles in other areas? So I'm just curious about some of the details here.
Yeah, so for the autonomous vehicles, I think that one of the biggest reasons why you're going to see it be more cost effective is that the Port Authority doesn't own the autonomous vehicles. So when we were talking with them, they just kind of said, like, we are not interested in owning like smaller vehicles. We only want to own like the public transit ones. And so, I mean, sorry, the buses and type of subway type things. So when they have like a partnership with Uber and Lyft where they're literally just paying for the cost of the ride, it actually becomes much more cost effective to take the overcrowding because it's such a small percent as well. So like the overcrowding is 12% or 4% of their total bus ridership. And instead of, having to buy like an extra bus. Now, when we looked at the, sorry, I'm trying to remember your second question. When
it was about whether in some of those high density areas, maybe a long bus would make sense. I mean, I know you didn't really model that, but I was curious if you thought about that. Like, would you send long buses to some areas and then do AVs where you have a really small amount of overlap?
Right. So we did not model long buses going to just certain areas. What we did was we actually modeled the longer buses on an entire route. So assuming that the entire route changed to a longer bus, because the other challenge is then, like, if you're only doing a part of the route and then you've now converted it to more of like an express route for that longer bus, then you also need more bus drivers, and that does start to change the dynamics of the simulation. And I guess this is like another sensitivity that we did. So this is a tornado diagram of the different policy alternatives that we looked at, where we can see how the cost changes. And for the AV, we used AV cost per mile as our, I guess, our cost metric. And I think that that's one reason why you don't see much variation in the autonomous vehicles, because on a cost per mile basis, since you're not having to replace the entire route, you're literally just going and picking up, a few passengers and taking them I think we use kind of like the median distance for the entire bus route, then you're not having to do that a lot. I mean, out of the Allegheny County cases, I think out of like 10,000 cases, right? I mean, sorry, not 10,000 cases. Out of 10,000 bus trips, then only 200 of them were over capacity. And so it's
that's
not
really
a lot.
interesting. Yeah, that's an interesting point, that the buses have a whole route, but these AVs just shoot out and get that one. And so that makes sense. Huh, interesting. Okay, very cool. Yeah, because it's very surprising to me. Like I was not expecting. I assumed that the AVs were going to be the most expensive options. So it's really interesting that they're the least expensive, and then in your one chart, they dominate. They're least infections and least expensive. Yeah. So that's fascinating. So very cool.
I have a question following on that. And you said that you would pay for the cost of the trip. Does it mean that the driver is not being tipped? Because I was going to, on your equity lens, because that model of transportation, people are being paid under minimum wage. There's a lot of discussions that is the tip that helps them a lot. So does it mean they would not get a tip, or you would have a standard tip per state? Like, have you thought of that, or have you modeling of that? Like, how are they being paid? In your
right. So we did not specifically model how they were being paid. What we assumed is that if they had a partnership with Allegheny County, that they would cover like a certain cost per mile of making that trip, similar to the reason that we thought about that was because that's how like schools reimburse us if we travel. So you get like a certain amount of cents per mile. So then that's why we have like a range of AV cost per mile, and that's what they would get. Now for the tipping, right, that works with Uber and Lyft, but again, there's no driver to tip. in an autonomous vehicle. So I think that's another reason why they're cheaper, because you don't have to pay the driver to be there. And that would, like, so if instead of autonomous vehicles, it was Uber and Lyft, then that would raise the cost of the autonomous vehicles, because now you have to pay the drivers and you have to pay their wages. Now, one thing I will kind of throw out there as food for thought is that the public bus system does typically operate at a loss, because they often don't recover all of their costs from their ridership, especially now during and what that is kind of one of the big discussions in Allegheny County is that, you know, the actual cost of the trip is not high enough to cover the cost of operating the bus fleet. And so that's one reason why I think that, but the bus drivers have a union, which is why, like, it's very unlikely that they would be able to make this partnership with an autonomous vehicle company or Uber.
Dr. Nock, I have more questions.
Okay.
I'm a big believer in fresh air, right? And when I see these autonomous vehicles, they seem to have a lot of fresh air, no windows. And also when you look at buses, I would think like April to September, you could open windows and let the fresh air circulate. Because I thought even on subways in New York City, I recall reading in the New York Times, they couldn't identify whether many passengers actually contracted COVID on the subways. At first, right, they were closing, they were cleaning them for hours overnight. Remember, like 2 to 6, 2 to 7, they had to move the homeless people. There were so many challenges, but ultimately, I don't think it was such a point of contagion. But obviously, so many people, like, you know, you're showing in the data, are so adverse to using public transportation now, and that has huge implications for the environment as well. So it's very, very troubling. So did you read more? Did you follow up on, you know, actual surveys? I know it's really hard to actually figure out. So you have to figure out, you know, where exactly, you know, they contracted it. And I would think with open windows, right, the doors opening and closing, that would circulate the air in part, you know. Yeah, thank you.
Yeah.
My brilliant undergrads, cross-ventilate, I agree, you know, has been proven to be very, very effective. And that's why I come to my class, I open windows. I want to keep the students and myself healthy.
Right. And I think that with ventilation, like, that is a good strategy that a lot of people have been using. But I think because we started this analysis in, like, more closer towards the, like, start of the pandemic, like looking at like January to, like, you know, February, March-ish, we assumed that the windows would mostly be closed because the buses are heated. And then over the summer, we do assume that they would be open. But the other challenge is that for the masks, right, we assume that everyone's wearing cloth masks, but one of the biggest challenges is that not everybody wears them properly, which would then also impact, like, the risk level on the bus, as well as the kind of, like, rate of needed circulation, right? So those are some inherent challenges in modeling this type of problem, especially because, you know, like, if we had assumed N95 masks, the rate of infection significantly dropped. Whereas, like, if you assume no mask, then it increased a lot. And that's also why for each size bus, we did have to do a different circulation rate as well, because there's more space and less space in areas.
Okay, thank you very much.
Yeah, and I'll also add in that, like, for these subway analyses, one of the challenges that I've seen in these transportation estimations of spreading COVID is that sometimes in their analysis, a lot of people, some of the researchers will include the infections that you get at your destination, not just on the mode of transportation, which actually gave it a really bad rap. But we actually excluded the infections at the destination, because if you took a personal car, if you took, like, you know, if you walked there and you got COVID at your destination, that has nothing to do with you actually taking the bus, which is why we were really focused here on trying to isolate the risk on the bus.
Professor Chatra, please.
Thank you. Hi, Destiny. Welcome back. It's great to see you.
Nice to see you too.
I enjoyed the talk. Thank you. Just a follow-up question. So I was wondering if you've thought about doing, like, a counterfactual scenario to see, like, if I understood correctly, the 4% is the infections that occurred on the buses. So, sort of looking at over time, is the 4% like per day? And, like how many infections would it prevent if you take the, the 4%, how many, the 4% of infections that were created on the buses, how many more infections did it add to the community? So sort of the cumulative reduction in the infections from reducing it by 4% per day.
Right. So we did think about doing that. The challenge with our data is that we had no idea where people went after they got off. And that's one reason why we did not include it in this presentation, because so to give a little bit more description about the data, it is from the actual bus authority, and we have the number of people that got on and off at each stop, as well as the number of people on each bus. And we have, the location data, and so we can tie those to individual bus stops as well as the size of the bus. But from actually traveling, especially when they get into like city centers, we don't know if people are going home, to the grocery store, right, to a park. And I think that that's one reason why we have excluded that counterfactual of that second level of how many cases has that increased in Allegheny County from like a second tier and a third tier, because there's also a discussion of like, when do you stop it, right? Like, when do you kind of stop expanding your scope of if people are contagious for, plus or minus 10 days, then, from there, okay, now you have to estimate how many people did they interact with, how many people are at each of those locations, what type of mask wearing are each of those locations and the types of buildings that they're in. And that was something that we felt was a little bit outside of our expertise.
Well, we do have time for one more question, so I don't know if
Sorry.
one more.
It's so I have one more. Can't resist. The how many days that one is contagious has been such an issue. And I thought it was really interesting that you put 20 days up. Where did you get that data from? I would, I'm kind of risk averse, so I would, go towards, more days rather than only 5 days like the CDC now.
Yeah, so that 20 days is based off of the fact that during our analysis, nobody was vaccinated. And so we assumed that, at first there was the 14-day quarantine period when you actually did start to see symptoms or you tested positive. Then we added in 6 days of uncertainty for when people are asymptomatic and they're not showing any symptoms. But that 20 days does inherently assume that this is in the pre-vaccination period. And the reason we did pre-vaccine is because we wanted this to be valuable in case, hopefully not, but in case something like this does happen again, to help inform the city's COVID mitigation plans or pandemic mitigation plans.
Thank you.
Thank you. Thank you very much. I want you all to join me to give a big round of applause to our speaker.
Thank you.
And a group picture, Paola.
Sorry.
Don't forget the group picture.
I will say that.
Okay.
I was going to ask, like, if whoever wants to put their camera on so we can do our e-picture. We've been doing that. So then I'll take a group picture of all of us. Smile. Okay, just a second. Gotta always take many to make sure everybody looks good. If you need to see, I'll copy and paste you over. So, in the name of the UMass Informed Student Chapter, I want to say thank you to Dr. Destenie Nock. It's always great to listen from her. We always learn so much. I was impressed to see her work in transportation because I was kind of expecting work on energy. And I was like, oh no, she also works in transportation. She's everywhere. So it's great. It's great to see you. For those who never looked at her blog, I strongly recommend. I particularly like the one blog post. I read it on my first semester. It was like, when you're having a bad day at research And every time that I'm feeling I'm beating myself down, I go back to that blog. So if you're needing a moral support, go back and then you can think, look where she came. That is her advice. Like, we can definitely tail that. I want to also thank you, Professor Naguni, who's here today despite multiple family issues. She's here with us, giving support. I would like to thank you all the other professors who joined us, all the students, and wish you all a very good weekend and wish Destiny a very good spring break. Thank you so much.
Thank you so much. Great to
Yeah, thank
see you.
for
Good to
having
see
me, and
everyone.
thank you for coming.
Happy Friday.
Thank
All
you.
the best. Bye-bye,
Happy
everyone.
Friday.
Bye-bye, everybody.